Hello and welcome to Med School. At the end of the iron deficiency anemia, start with the treatment protocol. So, the treatment of choice in iron deficiency anemia is oral iron. So, once we start our patient on oral iron, we need to keep monitoring the patients whether they are giving any positive response or not. So, for that purpose, we keep a check on reticulocyte count. Now, the question is, why reticulocyte count? Now, the reason behind retic count check is it was decrease in iron deficiency anemia because there is a decrease in maturation of RBC. Now what is happening is with the treatment of iron deficiency anemia, the RBC maturation and production increase, so the reticulocyte count also increases. So the best way to check the effectiveness of iron deficiency anemia treatment, we will check the retic count, and it is very cheaper also, and the reticulocytosis usually seen after first week of starting the treatment. And the other important thing is hemoglobin will start to increase after 3 weeks of the iron therapy, and hemoglobin become normalized after 2 to 3 months of oral iron therapy. So now the question arises, do we need to stop iron therapy after the normalization of hemoglobin in body? So the answer is no, because in the initial, whatever iron we are taking, it will be utilized as a erythropoiesis, and the iron store are still 0. So to normalize the iron store, we need to give at least 6 months of iron therapy. So now the advantage of oral iron therapy is there is a negligible chances of iron overload because it will passes through the GIT and there is hepcidin present in GI system, which will decrease the absorption of iron in excess of iron availability. Now let's talk about parenteral iron therapy. So this is the second form of iron therapy, which is injectable form, and the disadvantage of injectable iron form is it will bypass the GIT and there is no chance of interference of hepcidin, which will increase the chances of overload. And the second disadvantage is it can give anaphylactic and allergic reaction, which will sometimes life-threatening. Now we see the indication of parenteral iron therapy. So the number 1 is malabsorption syndrome, intolerance to oral iron as patient presents with nausea, vomiting or gastritis, and third is non-compliance to the iron. It means patient is not taking the therapy properly. These are some iron preparation which can be given in oral and injectable form respectively. Okay, thank you for watching. Please like and subscribe.